Today my topic is seamless shift handing over. So when I am talking about this topic, this is actually not a new topic for all the nurses, because since they were being appointed as a staff nurse, they most of the time, all the time during their work time, they will do the shift handing over. So the aims of this lecture is, the first one, to outline the roles and responsibilities of nursing shift coordinators, improve the accountability for the delivery of safe quality care for all patients on the wards or units, for the effective functioning of the ward or the unit. So first of all, we'll see what is clinical handover. Clinical responsibilities and accountabilities for some of all or all aspects of care for a patient or a group of patients to another person or professional group on a temporary or permanent basis. So let's see what incidents that we do the seamless shift handover. Shift change. A patient is transferred to another health service facility. A patient is moved in a health service facility, for example, operating theatre, ICU, or wherever. A patient's care is discussed during multidisciplinary team rounds or meetings. A patient is transferred for a test or appointment. A patient is discharged. So all clinical handovers comply with the following requirements. Let's see the requirements. The first requirement, the patient and the carer involvement. So we know the patients, with the patients there are carers, the caregivers and family members. We have to get their involvement to get the supported during the bedside clinical handover, taking into consideration the patient's wishes, goals and preferences. The next requirement is the leadership and team involvement. For team handovers, all available members of the multidisciplinary team caring for the patient must be part of the team handover. Appropriate modality. So when it comes to the handing over, shift handing over, handover must be conducted face to face wherever possible. Some handovers require the use of telephone or telehealth communication in foreign countries, but here we are not actually practicing that much. Written handovers must be in a standardized handover structure. Voice recorded handovers or SMSs and other social media platforms are not permissible. The other requirement is we have to do the shift handover, conduct in an appropriate environment. Selection of a proper location for the clinical handover is very important. It not has to be, it's a non-critical interruptions are limited and ensure there is access to supporting clinical information. Supported by written documentation. This of course is very important. All handovers of patients of concern must be documented in the patient's medical record. Next requirement is the agreement on responsibilities and accountability. So we have to know the roles and responsibilities and accountabilities which we need to be delivered, clear, described and agreed to by all staff involved in clinical handover. Appropriate training. So we have been trained, especially the nurse managers, they have to be ensure the clinical workforce or the nurses are definitely trained on the local clinical handover policy and the requirements. We'll see the procedural principles of clinical handing over. There should be allocated patients. So we know during the shift we have certain number of patients. Updated handover sheets enable access to electronic medical records. We have to obtain necessary charts, inform patient of pending handover. Discuss with patient who they would like to present at handover. For example, relatives. Request visitors to leave. Ensure patient is comfortable, for example, pain-free and order-free environment as well. Introduce of yourself. Who is the outgoing team leader who is going to hand over? And also we have to greet the patient and greet the two members who are doing the handing over. Introduce oncoming staff, including shift coordinator if present. Exchange clinical information. So what information that we are going to exchange? We have to use agreed format to exchange information. Avoid medical jargons. Ongoing staff to clarify and ask questions. For example, clinical condition of the patient, test procedures, ADLs and DZ planning. Being aware of the patient's goals and preferences. We have to understand the patient's values, patient's priorities, and what are the desired outcomes, which helps tailored treatment plans to their individual needs and preferences. Involvement of the patient. We have to ask from the patients whether they have any questions or any comments, any places to be clarified. Invite patient to confirm and clarify. Oncoming staff to discuss with patient care requirements for the following shifts. Finally, we want to make or perform the safety scan. So what are the needful things? Place call bell within reach. So actually we don't have call bells in normal wards, but in other special places where we having. We have to check the equipment whether they are functioning very well. Ensure mobility aids within reach. Check infusions, infusion lines, drainage tubes. Review medication cards. Review medication charts, and also we have to review bedside charts as well. And finally, we have to complete the handover. Again, we have to ask patient if they have any questions to be clarified, or ask oncoming staff if they have any questions. Ensure the clinical handover results in the transfer of responsibility and accountability of care. So here it's very important to use the structured communication tool ISO bar and document clinical handing over in EMR. ISO bar format. So this is the essence of this lecture. We know that we as nurses, we are doing shift handing over, and also we have a lot of documents, written documents, but here we have to be structured according to this structure. This is very important, and it's easy for us to transfer and also to communicate our things. Identify the patient and identify yourself. Introduce yourself to the person who you are going to hand over the patient. Introduce yourself and also introduce your patients. The situation. It's very important to describe the reason for handing over. Then the observations. Observations of the patient, including vital signs and the total assessment, the holistic assessments of the patient. Then the background of the patient, Pertinent patient information. What are the important things that you have to tell, you have to hand over. Agree the nursing care plan and the medical plan given the situation what need to be happen in future. Read back all the recommendations, confirm shared understanding of the patient. So this is the very important format that you can follow. Information of clinical handover. Patient identification. First of all, we have to know who is the patient that we are going to hand over. Next one, clinical team details. Who is the consultant, who is the doctor, who is the registrar or the SR of the next shift is going to be handled. Who is the clinical team details. And the diagnosis of the patient, provisional or the principal. Then the current clinical status of the patient, whether the patient is stable or improving or the condition is deteriorating. Clinical assessment including any relevant alerts. So clinical assessment and the nursing assessment is very important. Risks for harm, worries to be concerned. Medication history or current medication list of medications to be administered. Information for clinical handover. Next thing, very important, what allergies are the patients are having. So allergy to drugs or allergy to any food or whatever. Plast allergy, so you have to explain. Emerging or new critical information including new results. Results needing to follow up, agreed care plan, priorities of care. And also to be handed over the infectious status of the patient if it's appropriate. Transfusion or blood management history if appropriate. Identity and confirmation of clinician, healthcare team and carer responsibility and accountable for patient care. Transfer of responsibility and accountabilities. So not only the patient handing over, during the shift handing over, as nurses, we have to check the human resources of the ward or the unit. So what human resources that you have to transfer or you have to hand over. Number of nurses for the coming shift. Skill mix. Who is in charge of the ward and who are the absenteeisms. On-call medical staff, consultant, SHO, the registrar. Non-medical staff as well, the SKSs, cleaning staff and them. Not only the human resources, non-human resources, as earlier presenter told, the emergency drug trolley, crash cart, everything, whether they are according that all the drugs are available, everything you have to be checked and you have to take over. Medicines to be get down from the Indo pharmacy. What medicines, whether let's say if you are handing over the evening shift, the morning shift that you have ordered the drugs, but you have to get some drugs in the evening. So what kind of a medicines that you have to get down from the Indo pharmacy? Local purchase drugs to be signed by the consultant and the director. So everything you have to be hand over. Insurance documents to be filled. Machines in working order, especially the sucker machine, laryngoscopes, ventilators, pulse oximeters, infusion pumps and so on. Filled oxygen, wall oxygen with face masks and tubings. All these you have to check and take over. And what documents that you would have to be checked? Admission books, you have to check whether it's available or missing. Discharge book, all the BHTs are available or whether they have been taken into somewhere else. Charts, temperature charts, fluid balance charts, observation, neurological charts. So all these charts are available, whether they are practiced, whether they are filled and checked up to the certain time period. Drug books, documents, medical books, DC book, everything you have to be checked and hand over and take over. Giving over and taking over book, day and night report, duty rosters, sending and getting item books, drugs, equipment, everything, and all the protocols, new arrivals, they have to take over. Others, behaviors and risk factors for the patients, breakdown, sometimes the electricity, water. There are false patients, missing patients, prison patients, patients to be alert more, discharges and remains, transfers, all these things during the shift you have to hand over and take over. How to make work easy? Know about the days, the routine days, prioritize work, clarification or clarity of verbalization, what you are talking, you have to be very clarify you everything. Double reminders in writing, handing over name, designation, remind work for subordinate staff. So these are the challenges that you can come across. Time constraint, communication barriers, inconsistent handover practices, and your fatigue due to exhaustion from long shifts. Key elements for a good shift handover, you have to be focused what you are telling, your information about your each patient, and but prioritize things that you would have to talk. The consensus is very important, and also timeline is very important. So these are the factors that for the good elements for good shift handover, and also the completeness of your work. And the organization, the structure approach, such as using standardized format like ISO bar template to ensure all key aspects you have to be checked. So in a nutshell, what is seamless shift handover? A smooth shift handover in nursing involves structured communication to ensure continuing of patient care. It should be focused, concise, timely, complete and organized. Key aspects include face-to-face communication, sharing both verbal, written information, and understanding the incoming staff's information needed. Thank you.